Alan Johnson,
Hi.
Sajid Javid's going to be making his first appearance as Health Secretary in the next hour or so. What do you think he should be the first thing he does as he sits down at his desk?
Get a proper briefing about what's going on. He has got the luxury of being appointed at the weekend, so sometimes health secretaries and other cabinet ministers are appointed at lunchtime, and then at 2 o'clock have to go onto the floor of the House of Commons and stand at the dispatch box and act as if they are all knowing about every issue in their department. Sajid's got at least got a few days. I think he's a good appointment, by the way. I think, in a cabinet of sycophants, which has been one of the problems, he stands out because he refused to accept the outrageous demands placed upon him by the Prime Minister and Dominic Cummings, and gave up his job as Chancellor on an issue of principle. And I think that stands him in good stead. He's got a huge, it's not just the virus, by the way. The NHS is going to go through a huge change, a beneficial change, because they're going to reverse all the Lansley reforms. This is part of the NHS plan that the government thankfully have accepted, and go back from a system where they were, you almost had to have a competition lawyer in the corner every time one hospital talked to another. They're going to go towards cooperation and integration, and that's a very big and very beneficial change, and it has to be put through in legislation over the coming year.
You mentioned Dominic Cummings, and I'm afraid I just can't resist asking this. Do you have any sympathy for how Mr. Cummings might feel this morning, having, in a way, got rid of his nemesis? He said Hancock should have been sacked 15 times last year and so on, and no doubt have been cheering when Hancock went, and then to find he's been replaced by the bloke that walked rather than take Cummings's orders. It must be a bit disappointing for him.
I have absolutely no sympathy for Dominic Cummings at all, and neither would he require sympathy. But what he said about Matt Hancock's failings are all there in a wonderful book called Failures of State by the two Sunday Times Insight journalists. It was published back in March. And strangely enough, although it contains every dot and comma and much more of the disaster that was this thing that Hancock did. I mean, Hancock took 15,000 people out of hospitals and put them into adult social care. So he took the most vulnerable to this disease and placed them in the area where they were most likely to get it. It had terrible, terrible consequences. Hancock's point was that he told the Prime Minister that it had all been done safely or whatever it was. But read the book, Failures of State. It shows how there were absolutely no safeguards. All the regulations were suspended for this mass migration of elderly people out of hospitals and into adult social care. It was a disaster, and one of many disasters in those early days that hopefully will come out in the inquiry when it's eventually held.
We're hearing about further, let's call them, failures of state this morning. We are hearing about personal email accounts being used when perhaps they should not. And we are hearing about the inquiry, which Brandon Lewis told this programme will be mounted into how those pictures of Mr. Hancock and his aide were found. And of course, we've now just had news that sensitive defence documents were found at a bus stop in Kent. Home Secretary, Health Secretary, this must be the sort of nightmare that you wake up sweating about.
You might remember, Trevor, because like me, you go back a long way, Alistair Darling getting castigated over some NHS records that went missing back in 2009, I think it was, and they were Treasury documents. And I hope the same kind of castigation is going to fall upon this government. On the first issue, I could never understand why there was a camera in the Secretary of State's office. There was never a camera in my office when I was Health Secretary or in any of the other 5 cabinet positions.
I think the rule is that cabinet members are not to be monitored by anybody, including security services, without express permission of the Prime Minister.
Exactly. Yeah, it goes back to Harold Wilson's time. Although, of course, our telephone conversations, there's always someone listening in. There's a member of your private office to get a record so that you've got some justification and some backup for what's talked about. So this private telephone account of Matt Hancock's, through which apparently he negotiated some of these extremely questionable deals for his mates to get large lumps of taxpayers' money, that's certainly worthy of investigation. So there are problems here that need to be looked at and go beyond Matt Hancock. But as for Matt, I mean, you might have covered this, Trevor. I thought when this Neil Ferguson issue arose, Matt Hancock didn't have to pile in on Neil Ferguson. He chose to pile in and say that remember Neil Ferguson had a visit from his girlfriend,
yes,
that it was extraordinary behavior and that everyone had to obey the rules, and even went so far, although the police had declared they were not going to take any action for this breach of law, Matt Hancock said, if they do take action, I will support them. I mean, it's talk about, a justified comeback. When you do that to someone, a sage advisor, it wasn't even a cabinet colleague, someone who couldn't really answer back, you deserve everything you get.
Alan Johnson, let's take it away from the person for the moment. What is emerging about the culture of this Department of Health? Contracts allegedly granted to cronies. We don't know to what extent Matt Hancock was involved in any of that, but the story that's being told is that there's cronyism, that there's a chamocracy, that email accounts are being used to keep information away from officials. Now, you were there, I think, for a bit more than a year.
2 years.
That long, okay. Did you get any sense of that being the sort of underlying culture in this department?
No, and I think you can't divorce it from individuals. I think this is a Boris Johnson style government. Maybe Cummings was in there as well. All this, well, let's waive all the rules, bonfire of the rules and do what we want to do when we want to do it. I was also there through a pandemic, of course. It wasn't as extensive as this one, but we thought it was going to be. It was the return of H1N1, Spanish flu, that killed billions of people, literally billions, back in 1918. It had come back, and we thought it was the big one. So I saw how the NHS operated, and I had real admiration. There's, the chief medical officer working with the NHS, working with the department. It's a tricky organisation to run, but there was nothing about that organisation that suggested cronyism or anything else until the kind of government cronyism came in.
Just very briefly, Alan Johnson, how will you judge Sajid Javid, or what will be the key performance indicators on which you would judge him, leaving party politics aside, on whether he has been a good health secretary or not?
Well, I've left party politics aside to welcome him. I think he's a good appointment. I think he's the best possible appointment, other than perhaps Jonathan Ashworth under a Labour government. But I think Sajid, getting on with his job quietly, undemonstratively, and in a measured fashion. That's what the NHS want to hear. He needs to get out there amongst the NHS. They don't want someone who's looking for headlines every evening and who's looking to kind of climb the greasy pole. Sajid's already done it. I mean, he's held two of the...
Are you saying that... Are you talking about anybody in particular there?
Maybe. Not me, I assure you. But that's why you can't divorce it from the personal. I mean, Jeremy Hunt was in many ways a very good health secretary. In the years he did that job, I've got my issues with him, but, he sort of exuded confidence and quiet, modest, a quite modest approach to politics. And I think that's what Sajid will bring as well.